Today, we're discussing what experts call the most neglected condition, uncontrolled blood pressure. According to the CDC, nearly half of all American adults have high blood pressure, but only 1 in 4 have their condition under control. High blood pressure, or hypertension, is often called the silent killer because most people who have it don't have any symptoms. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. May is High Blood Pressure Awareness Month, and this week we're discussing the serious impact it has on your body and the most important thing you can do about it. With me today is Dr. Tracy Stevens. She's a cardiologist and the medical director of the Muriel Kauffman Women's Heart Center. Thank you so much for joining us.
Thank you.
So Dr. Stevens, first of all, can you explain what high blood pressure is?
High blood pressure is essentially the pressure that our blood vessels create in our body. And so if we think about it, like when we blow up a balloon, you can feel that pressure and the resistance the balloon gives back. In our blood vessels, which, as we know, travel to every organ in our body, they have nerves that wrap around them, and those nerves give signals to our blood vessels whether to dilate or constrict. So high blood pressure is, think of it as a state of constriction of those arteries where that raises the blood pressure. If we can dilate those blood vessels, then the blood pressure falls. So it's the resistance created in our blood vessels that can be created by what's going on in our day-to-day lives.
Okay, very informative. So what are the guidelines for blood pressure?
The guidelines for blood pressure can be quite confusing, but if we want to just simplify them, strive for your blood pressure to be well under 130/80. Now talk to your healthcare provider because for your condition, there may be different goals. Are you over 80 years of age? Do you have heart failure conditions? We may want different goals. But generally, for the general public, strive towards under 130/80. Now, lifestyle is very important to treat our blood pressure, but sometimes medications are needed too. Certainly, we think of medications that despite our lifestyle changes that we need to think of if it's over 130/80 in patients who have had heart attack, stroke, diabetic, or kidney disease.
Okay, so how does high blood pressure affect our cardiovascular system and our overall health?
High blood pressure, if you think about is that constant high pressure essentially against our blood vessels. So if we think about, again, where our blood vessels travel through our body, that organ that vessel supplies can have impact of chronic high pressure. So uncontrolled high blood pressure today is the most neglected condition. It's the single most important risk factor that's causing dementia, blindness, stroke, heart attack, heart failure, atrial fibrillation, which is one of the leading causes of stroke, kidney failure, and erectile dysfunction. It kills over 1,000 people a day and is one of the leading healthcare expenses for our country if it's not controlled.
What symptoms indicate you might have high blood pressure and should speak with your provider?
I think it's very important to emphasize that it's the silent killer, so you may not have any symptoms sharing with you that you have high blood pressure. The only way to know your blood pressure is to check it. Never assume because you feel well that your blood pressure's okay. We know that sometimes you can have symptoms if you have a severe headache, vision changes, ears look red and burning, heaviness in the chest. New symptoms, always think, could this be my blood pressure? Again, the only way to know it is to check it. And I really encourage everyone to have a blood pressure cuff in their home and get in the habit of checking one's blood pressure at least once a month. Keep a diary. If you find it's elevated, check it more frequently.
Can you elaborate on that? Why is it so important to monitor your blood pressure at home?
It is so important to know your blood pressure where you spend the majority of your life. So in the clinic, that blood pressure reading gives us some insight, but people say, oh, I've got white coat hypertension, or the traffic was bad, I was rushed, that's why my blood pressure is high. Well, if stress is making your blood pressure high, I suspect you're under stress at home. I think it's very important to take ownership of your blood pressure. It's not what it is in your doctor's office, but it is where you spend your life, where you work, worship, play.
Okay, so what lifestyle strategies can people take to address their blood pressure at home?
It's important to note that just with lifestyle changes, many of us can control our blood pressure in that way. And there's so many things we can do. The key is it's discipline to doing them regularly. So eat healthy, stay active, ideal body weight, don't smoke, limit alcohol, and avoid prolonged sitting. Now, sitting, we share, is the new smoking. If we really modify those lifestyle habits, that can really make an impact on our blood pressure. But it's also important to know that if you had high blood pressure during pregnancy, if you have a family history of high blood pressure, stress is a big one. So under stress, be mindful of what your blood pressure is doing. And be cautious of over-the-counter supplements such as anti-inflammatory medications, alcohol, nicotine certainly can raise our blood pressure. Medications to treat ADHD, birth control pills, hormone replacement therapy. Being mindful, these scenarios also can raise our blood pressure.
Okay, all very helpful information. Thank you so much for joining us today.
Thank you.
To learn more about high blood pressure, visit stlukeskc.org/blood pressure. You can also find updates on other health news at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.